and gentlemen, it's great to be here with you today. I get to tag along with the First Lady, and I appreciate you welcoming me and letting me come up on stage for a few minutes. Obviously, she's very passionate about this work, and as she was working through with her Chief of Staff, Kirsten Rapley, who's here, trying to figure out what it was exactly that she wanted to do. I remember coming back and saying, I know we're supposed to have an initiative. Is 4 okay? And of course, I can't say no. And all of them tie together so beautifully. And we're lucky to live in a state with so many good people who are willing to step up and help. So we have some time, and what we thought we would do is just open it up to questions. Anything that you've ever wanted to ask the governor or first lady, and I mean this sincerely. Nothing is off the table. We can talk about COVID. We can talk about the football game last night. We can talk about anything that you want to talk about, but we really do want to try to answer your questions and anything that you might be curious about. So we have a microphone that we can pass around, and Curtis, go ahead.
What tips can you give those of us that are serving in our spheres of influence?
Well, I will say this. First of all, as Governor Herbert knows, that is a challenge, and we are very fortunate, the First Lady and I, to have learned at the feet of the best governor and First Lady that this state has ever had, and they taught us so much about the importance of family. If he were up here, he would tell you that every Sunday their family got together at their home in Orem. I think they have a son here. Daniel's here. He can tell us that this is true, and they made sure. There were always grandkids at the mansion. The family was a huge priority. As Lieutenant Governor, we made some decisions that family was going to remain important to us. Governor Herbert was kind enough to let us live in Fairview, to stay there, so Abby could be there, surrounded by other family members to really help us out. So we have transitioned to Salt Lake now, and we spend at least every other weekend we're back in Fairview. We're fortunate now. 3 of our boys are out of the house. We have one that just got home from a mission, one that just left on a mission, and so our 2 oldest boys are now down at SUU. And so it's just our daughter. She just started as a freshman in high school, and she went from being one of 4 to being an only child. She's not enjoying that. She's still very mad at us that we left Fairview, where all her friends were, and now she had to go to the big city to a new school where she doesn't know anyone. We let her choose which school she wanted to go to. She's at Skyline now, so she's an Eagle and learning what all of that is about. But here's how we try to manage it. Scheduling is critical. As a governor or whatever you do in your life, if you don't take control of your schedule, the schedule will take control of you. And so we've made that very clear that there are certain things that we have to do, understanding that emergencies come up. So I take my daughter to school every day. That's just really important to me, that we get that time together in the car. Her school, she has to be there at about 7:15, so that's, I get up early, do what I need to do, get her to school, and then come back and get some more work done and get the day started. So that's one way that I make sure that she and I connect every single day on top of other things. But I'll let the First Lady answer that as well.
No, I think that's right. I think prioritizing, your children, your family, obviously, that's important. We put those things in place. And then, again, our kids are going to learn resilience through our scheduling and the craziness that's going on. I'm watching my daughter. I said to Spencer, like the first 2 weeks, I said, we may be killing her. I know what doesn't kill you makes you stronger, but we may legitimately be killing her. So I think she thought we were killing her. So the transition was tough, but she's resilient, and she's coming through and just doing amazingly now. So it's been fun. Thank
you, Curtis. Other questions? So Bill asked a question. He said, Utah seemed to bounce back better than most other states from the pandemic, and I'm going to take all the credit for that, none to my predecessor, which he knows is not true. He likes to point out that the unemployment rate was all the way down by the time he was gone, and he's right. But the question, this is the question. We do have the second lowest unemployment rate in the country right now, highest GDP growth, one of only 2 states that had positive growth over the last year, us and Idaho. But you said we're still having a hard time getting people back to work, right? So this is what everyone in the country is trying to figure out right now. We actually just 2 days ago we commissioned a study. The study has not started yet, but we're trying to do an in-depth study to figure out where all the workers are and what exactly is happening out there. I've had several discussions with economists here in the state of Utah to try to figure that out. I'm sure I just know all of you are facing labor shortages right now. We don't have a single industry in the state that is not facing a labor shortage. Engineers, dishwashers, teachers, firefighters, police officers, you name it, whatever it is you do, you don't have enough workers, or if you need to find workers, you're struggling right now. A couple things that are really interesting that we're finding through this pandemic. So one, obviously, there have been significant increases in pandemic-related benefits coming from the federal government. We know that. So certainly that has played a role. It's one of the reasons that we ended the pandemic benefits here in the state of Utah, some of them early. We took a lot of flack for that, but I believe it was the right thing to do because there were jobs available and the pandemic was waning. That helped somewhat. We did see a small bump in people coming back at that point. Second piece of this, there are a lot of people who retired, who decided that, we had baby boomers who were working longer than normal, who just decided that this was a good time to be done and to retire. So we had large retirements. The third thing that we found is we had a lot of, especially women, but not just women, who came home during the pandemic and realized that they wanted to stay home. They realized that there was something missing, and they felt that that was very important. Now, lots of businesses are continuing to allow for work-at-home policies, but many moms especially have gone part-time, and some of them have just decided that they want to take a pause from the workforce, which, again, is not a bad thing, but it's a bad thing if you need to hire those people. And so we support that, and we hope that these flexible schedules will become more routine. Certainly they are for the state. Governor Herbert and I had actually started a pilot project, a work-from-home pilot project before that. We've expanded that significantly, and that flexibility is something that families really, really love. So all of those things are true, but here's the one we're really struggling with to figure out. We have the fewest amount of young men ages 16 to 24 per capita in the workforce than at any time in our state's history. And it's really easy to say that they're all just home playing video games. And certainly that is true. There is some of that. There are maybe you have some of them in your basement right now playing video games instead of being in the workforce. But it's something larger than that, and that's part of the study that we're hoping to figure out more why that is happening. We have more young women in the workforce than ever before, and less young men in the workforce than ever before. We also have, by the way, this matches education. We have more young women going to college than ever before, and fewer young men, again, as a percentage of the total, going to college than ever before. And I think a part of this has to do with the affluence of our state and our day, too, in that when we went to college, we both worked. Even when I went to law school, I had a part-time job on the side. We had to pay for ourselves to go through school. That was the only way we could get through. And that's not the case anymore. In fact, many colleges and universities discourage young people from working, and many families don't expect their young people to work while they're going to college. And so I think all of that plays a role in it. But we want to get better information and figure out how we can, what policies will actually have an impact on getting people back to work. Because, again, unemployment being low is great, but the workforce participation piece is pretty low right now, and that's very discouraging. And that's the biggest threat to our economy right now. Maybe the second biggest threat, inflation being the biggest threat from all of the fake money that just keeps being poured into the system. But a lack of people is also inflationary, right? Because wages, you have to pay more. We're fighting over the same small group of people, and that's going to lead to even more inflation as we go forward. Higher wages are really good for our workforce. That's important, but there has to be a balance there, and it feels like we're out of balance. So hopefully we'll be able to get that back in balance soon. Sorry, that's a long answer, but that's the best I've got right now.
I don't know. I can tell you that when I talked to Pamela Atkinson specifically about refugees, because I've had many questions about how do we help. We are such a beautiful state who loves people with a different story, who embraces refugees, which I think is absolutely amazing. But there are organizations, and what Pamela told me is right now they need money because they have organizations that are setting up housing, taking care of health care, all these things that they're getting prepared for when the refugees arrive. And so that's how we're going to do it. The other ways we can do is our what we're doing for our service project for the refugees, specifically is we are getting gift cards. And so that's what we're doing with Procter & Gamble. We thought that was the best way for families to use the money is through gift cards, and so that's kind of the Procter & Gamble service project that we're doing. But you can talk more about.
Sure, yeah. So as Abby mentioned, we have some organizations. We have 2 refugee resettlement organizations here in the state of Utah: Catholic Community Services and I just drew a blank. International Rescue, thank you, IRC. Those are the 2, and they have donations on their website, great places to donate. If you are a landlord, we are working with our various associations in the state, and your association. Housing is a big deal for everyone. Obviously, housing is going to be a big deal for the refugees that need resettlement, and so we would encourage you. And people have been so generous as we've talked to our landlord associations in the state. They've just been incredible, and they are coming forward and saying, "Hey, we have units available. We'll set those aside for refugees, and we're willing to help." But those are areas where we could desperately use your help as we move forward. Thank you.
Things like aging out of foster care and the waiting list for people with disabilities, you're a dynamic duo for that. You actually have a friend that can help you with those challenges. Are those some of the bigger challenges that you're also looking at in some of your initiatives?
Yes, absolutely. In fact, we're partnering with an organization called America's Kids Belong, which is a really cool organization that is focused on those waiting children. So if a child, there's lots of times that a child, even after aging out, would love to be adopted. Can you imagine, most of us can't, being, okay, so I'm on my own. I've aged out of the foster care system. I don't need someone day to day to take care of me. But can you imagine what it's like? Where do you go for Thanksgiving? Where do you go when you need help with a job application? Where do you go when you need help navigating higher education, which is insane? I've done it with 2 sons now, and I went to college. So can you imagine if you were a kid that had no idea how to navigate the systems in all these places? So you think kids aging out are done, they're on their own. They're actually the most at risk kids in our communities, the most at risk for incarceration, the most at risk for drug abuse, the most at risk for suicide. And so being one of those caring adults in a child's life is critical. I think the idea of taking care of the adults with disabilities is, again, a huge opportunity for us to reach out as a community, look at our needs, and take care of those around us.
Yeah, thank you. It's a really important question. I think there are some policy changes that we can make around that. Some other states, especially aging out of foster care. But I just want us all to think for just a second. There are 2 things that Abby has talked about that I think are so important here. One is what happens when we don't take care of kids early on. And even if, let's put the humanity aside. Let's just be just true fiscal hawks for a second. If you think of the amount of money that we end up spending on these kids over their lifetimes, in the form of welfare, in the form of prison, drug addiction, and homelessness. I mean, some of these kids end up being $1 million kids. When I say $1 million kids, it means that taxpayers end up spending $1 million on these kids throughout the course of their life because they have a life of misery. And the social costs of that. If we can help these kids younger and get them these skills, and not just kids in foster care, kids who have lost their parents, parents, but all of our kids. I was just down in Sevier County last week, and we were talking about social and emotional learning and some of the things that are happening there. They've, through an initiative that Governor Herbert put in place, we've been able to get counselors and basically psychiatric help, mental health help into elementary schools, more than we've ever had before. And in these schools down there, we had one principal who said, I can't remember if it was in elementary or middle school, I think it was in elementary, who said that he was getting office referrals, so kids getting sent to the office for bad behavior, 20 to 30 a week on average. That was his average week. Once they put this mental health counselor in this school, it went down to 2 to 3 a week, because they're able to help these kids overcome the severe trauma that they've been through. And if you know anything about trauma-informed care, if you know anything about ACEs, adverse childhood experiences, and what happens when you have parents who are divorced, parents who use drugs, parents who are abusive, any of these trauma things that happen young in life, the likelihood that you're going to make it out and be successful on the end goes down with every one of those traumas that you experience. This is just pure math. We've seen it over and over and over again. But if we can intervene and help these kids early on to learn how to be resilient, to learn how to emote and deal with these problems in appropriate ways, instead of just sending them to the office and sending them to detention and sending them to juvie and sending them to jail, which is exactly what happens, if we can intervene early and teach them these skills, then they have a chance. We're giving these kids a chance. And that's going to save billions of dollars in taxpayer money, and it's also going to lead to happier lives for these kids. And so this is really where it all comes together, where we need the private sector, the public sector, the nonprofit sector, and the faith-based sector, all of us coming together to really rally around these kids and make a difference. And we desperately need your help in that. So thank you for that question.
Right now, roughly, we have about 2,400 kids in foster care. We have around 500 foster families. Just making sure I'm getting these. And we need a lot more. So you can see 24 to 500. So we need more. There are roughly 125-ish waiting children. So those waiting children are kids, they're usually kids with disabilities, kids that have been in and out of foster care that are hard to place. It's usually sibling groups. It's usually they have social or emotional trauma and troubles that they aren't. They're the kids that people are not. They're usually older teenagers. But so that's the ones that we're focusing on, really finding a place for them. Yeah, so this is the thing. With the foster care system, sometimes you look around here, maybe you do. Maybe you're hearing this right now and saying, I could definitely be a foster parent. Maybe I am at that point in my life, and that is fantastic. We need that. So we need you to go to Utah Foster Care and sign up to be a foster parent. Maybe you're not at a place right now where you can do that. The best thing that you can do is to become a part of that family's caring community. Caring communities are this idea that we foster the foster family. We take this family, and maybe, I take food in once a week. Maybe I take a kid to soccer practice. Maybe I help get a kid to one of their appointments. Maybe I'm mowing the lawn for this family, but I can become part of somebody's caring community, even if I'm not doing the foster care myself.
And just imagine if we had, if every, for example, every LDS congregation and every Catholic congregation and every religious congregation in the state, if one family in that congregation decided to foster, and then 10 families decided they were going to take care of that one family. So we're going to help you get to doctor's appointments. We're going to bring you food once a week. We're going to, if we did that, we would be done. We would have every kid taken care of and every family taken care of. I think we have the power to do that. We need the organization to do that, and you can do that in each of your communities, and we're working with churches to do more of that.
Any good trends coming?
Thanks. We almost got through without a COVID question.
Oh, sorry.
But no. It's an important one. It's an important one to talk about. And Let me answer the question. The answer is yes. Some very, very good signs. So what we know about the Delta variant of COVID is that it's impacting everywhere. Eventually, every place gets it. Everyone thought the Northeast was not going to get it, and now the Northeast is getting it. They're surging. In Utah, our beds are full. They absolutely are full. The good news, though, is we're still in the bottom 15th in hospitalizations right now during the Delta wave. So that's good. It's bad that they're full. But what we've seen is about 2 to 3 months, this wave tends to go up and then it tends to come back down. Nobody can exactly explain it. There's an article in the New York Times today talking about that. But 2 weeks ago, we started what looks like the decline. So we were down about 16%, our cases. Now, this started 3 weeks ago. Last week, we've leveled off a little bit. We've seen it flattening out a little bit. We're hoping that we'll start to come back down again. We've seen hospitalizations start to make that curve as well, to start to come down. So there are definitely some positive signs out there. What we do know is that the vaccination rates absolutely matter more than anything else, and that we're doing okay. Not super great in the state of Utah, but not terribly bad like some other places. We're just about average, a little below average for adults being vaccinated. We obviously have more kids than anyone else per capita, and so that skews the numbers a little bit if you're just looking at total vaccinations, because kids under the age of 12 aren't eligible, and we have a greater proportion of those. So it's heartbreaking. There have been, I want to say, about 700,000 deaths in the country now. Is that right? And it's estimated that close to 200,000 of those did not have to happen if we'd been vaccinated at 100%. If everybody had gotten a vaccine, about 200,000 people would be alive today that aren't. Certainly in Utah, we've been better. We're in about the bottom 6 or 7 when it comes to mortality rates. We're at about 3,000. We'll hit 3,000 deaths. And unfortunately, what we're seeing right now is that there are younger and healthier people that are dying from COVID this round than the last one. And the thing they all have in common is that they were not vaccinated. Lost a young friend of mine this past week. He's got 3 little kids under the age of 6. And he's gone and would assuredly be alive if he had gotten vaccinated. So that's very disparaging. Please thank your daughter. No one has done more. And I'm going to say this because it needs to be said. I'm so sick and tired of the misinformation that continues to be spread, especially about the vaccine. When I talk to doctors right now, okay, this is what I hear. Their beds are full and they're doing everything they can. Nurses the same way. About 1/3 of the people that come into the hospital recognize they have the disease. Some of them have been vaccinated, and some of them wish they had been vaccinated immediately. Another 1/3 of them come into the hospital and don't believe they have the virus and are just mean. They treat our healthcare workers with contempt. They're angry at them, and they don't believe anything they say. But by the time they die or leave the hospital, they recognize that they made a mistake and they feel terrible about it. There's another 1/3 who by the time they die or leave the hospital are still mean and still treat our healthcare workers with contempt, and their families treat them with contempt. It's an evil, it's a scourge in our society, and we should be absolutely, utterly ashamed that we have failed as a society with the very, very basics. And so if you have an opportunity to stand up to the bullshit, please do it, okay? Because people are dying that don't need to die. And if they want to die, that's fine. But don't treat our people who are trying to save their lives that way. And I'm sorry for using my farm words. I shouldn't do that. Abby reminds me not to do that. But thank you. We love you. Keep up the good work.